My name is Nicole Saritelli, and I'm 41 years old, and I live in Vinton, Virginia. When my daughter was born 10 years ago, I had a pretty normal pregnancy. I mean, everything was fine. The labor was great. It was 12-hour labor, but it was great and stuff. But after I had her, I had the normal incontinence. Like, you know, a lot of people will have that if they have a vaginal delivery. And ever since then, the doctors would say, it'll get better, it'll get better. So I didn't think anything of it, but as time went by, I was realizing it wasn't getting better.
I'm Harris Wexler. I'm an OBGYN, and I specialize in minimally invasive surgery, gynecologic surgery.
First time I actually came to Dr. Wexler, his office staff was incredibly welcoming. The facility itself was very welcoming too. I never really had to wait long, and I liked that. And when he came in, I said he was very welcoming. He answered all of your questions, took his time with you. He was very kind.
You know, my care philosophy, I think, is just to listen to people and then laying out your options. I mean, there's non-surgical treatment, there's medical treatment, there's procedures, and if surgery is what's right for you, then I want them to know exactly what they're getting into, what to expect, how does this affect long-term, what can they expect the day of surgery, during surgery, afterwards. And just listening and then giving people the option, saying, what do you want to do?
Even if you wanted to ask him something that you felt very uncomfortable with, he answered thoroughly, and you never had to feel like he wasn't understanding anything. And I felt like he was very knowledgeable in all of the questions and answers. Before I had my surgery, my daughter, she's very active, always wants to run around and play. And in the backyard, we would be running and she'd be like, "Mom, chase me." I'd say, "Honey, Mommy can't run after you," because I was always afraid that, I might have a little accident or something. And ever since I've had my surgery, I'm able to do that. And as a matter of fact, the other day we were taking a walk and she started to kind of jog a little bit. And she said, "Come on." I said, "Okay." So I actually was able to kind of jog with her, and she was so surprised and so happy. And so now it's like we do, play, and we do run, and we do play those games where Mommy, I couldn't do that before.